According to the covenant, healthcare organizations, let's say hospitals for now, should set up a file that aids in acquiring new devices. In that file, it should be documented why a new device or new type of device is needed. It should contain a program of requirements for the new device and a risk analysis to show what dependencies or hazards there are. This risk analysis should also check for effects of the new device on the existing healthcare process, check cybersecurity, and much more. The acquisition file should also state what the required proficiency of the future users and technicians should be and how they will be trained to get to that required proficiency level if they aren't. The file should contain a periodic evaluation plan to keep track of any changing situations, risks, adverse events, and complaints from the users or technicians. And, maybe the most important thing, all relevant disciplines must be involved in the acquisition of new devices. That's to make sure that, for example, it's not just one surgeon getting the device they like because it is so pretty in pink, while it would be impossible to maintain for the technicians or be much more expensive than alternatives in a different color. Very often a hospital test runs a device for a while before buying it, especially when it involves buying tens or even hundreds of the same device. The hospital should have clear procedures for such test placements. This will be about how the device, which potentially still has unknown risks, is used, by whom, on which patients, and for how long. And how will any adverse events or pros or cons of the device be registered? Once it has been decided what device is best and will be bought, there must be a procedure for ordering the device. In such a procedure, the hospital could, for example, make sure that there's always a check of the contract by the hospital's legal department, that someone checks the device is ordered from the best or cheapest supplier, or that someone checks that the parts for maintenance of the device are also ordered along the device itself. Then, at some moment, the device will arrive at the hospital and it's unboxing time. In order to be able to do good maintenance, track any issues with the device, and simply be able to find the thing, it should be clear how to register the device and keep track of anything related to it. Furthermore, there must be procedures that ensure that before the first use of the device, the user manual is available and known to users and other involved personnel. This manual must be in the local language to ensure anyone can use it. There must also be procedures for making sure that users are proficient to use the device, for checking that the device actually works, and for checking that the device properly matches the infrastructure, like IT networks and cleaning processes of the hospital. If all that is properly set up, documented, and, very important, also actually followed, then the device should be ready and safe to use by proficient users and in a fitting environment. But although well begun is half done, it is still not completely done.